Hi friends, welcome to this video on renal function tests. First, what are the functions of kidney? Filtration of waste products from the blood and tubular reabsorption of useful substances from the filtrate and tubular secretion of unwanted substances back into the collecting ducts and maintaining the normal blood pressure by balancing the electrolytes in the blood. Biochemical tests of renal function include measurement of GFR by clearance test and renal tubular function tests like glycosuria, amino aciduria, and specific proteinuria and osmolality measurements and urine analysis. Urine analysis by appearance, pH, urinary sediments, specific gravity, etc. Normal values include blood urea 15 to 40 milligram per deciliter and serum creatinine 0.6 to 1.2 milligram per deciliter. Uric acid 4 to 7 milligram per deciliter in males, female 3 to 6 milligram per deciliter. Sodium 135 to 145 millimole per liter and potassium 3.5 to 5 millimole per deciliter and chloride 96 to 106 millimole per deciliter and bicarbonate 23 to 27 millimole per deciliter. Arterial blood pH 7.35 to 7.45, arterial PCO2 35 to 45 millimeter of mercury, arterial PO2 80 to 100 millimeter of mercury. So how to calculate GFR? Creatinine clearance can be calculated as follows. Creatinine clearance equal to urine concentration of creatinine multiplied by urine output in ml per minute, 24-hour urine volume divided by 24 into 60, and P is concentration of creatinine. Reference value normal range of creatinine clearance is 120 to 145 ml per minute. These values are slightly lower in women. Serum creatinine normal range we already discussed. Grading of CKD based on GFR. Minimal damage with normal GFR grade 1 if GFR is more than 90 and mild damage with slightly low GFR 60 to 89 and moderately low GFR 30 to 59 and severely low GFR 15 to 29 and kidney failure less than 15. First, protein. Protein as a routine chemical test performed on urine, the most indicative of renal disease is protein determination. The presence of proteinuria is often associated with early renal disease. Normal urine contains very little protein, usually less than 10 milligram per deciliter or 150 milligram per 24 hours is excreted. This protein consists of primarily of low molecular weight serum proteins that have been selectively filtered by the glomerulus, and albumin is the major serum protein found in the normal urine. Normal is less than 10 and 10 to 29. High is 3 to 299 and GFR best is more than 105 and 90 to 104. Low is 75 to 89. Urine analysis include chemical test and microscopic examination. So this is an example of urine analysis here, where quantity is pale yellow, color nil, and turbidity nil, and specific gravity is 1.012 to 1.030 and pH 4 to 8. And sugars, proteins, ketones, bilirubin, blood, everything is nil. And microscopic examination, pus cells less than 3, RBC nil in males, and crystals nil, and epithelial cells should be less than 3. Colorless is very dilute urine due to overhydration. Cloudy or milky urine, phosphaturia, pyuria, chyluria. Red color urine, hematuria, hemoglobinuria or myoglobinuria, and anthocyanin in beets and blackberries, and chronic lead and mercury poisoning, and phenolphthalein, bowel evacuants, and phenothiazines, and rifampin. And orange color urine is seen in dehydration, and phenazopyridine and sulfasalazine. Pyridium used for UTI makes strip results unreliable. Urine dipstick analysis interpretation. Proteins are too large to pass through glomerulus. Proteinuria usually represents an abnormality in the filtration barrier. Normal is negative. Trace amount is normal in pregnancy and after eating lot of protein. Albuminuria is albumin in the urine. Bilirubin. Bilirubin indicates the presence of liver disease or biliary obstruction. Small amount of bilirubin in the urine is normal and excessive amounts is called bilirubinuria. Appearance of bilirubin in the urine, yellow foam when sample is shaken. Glucose. In general, presence of glucose indicates the filtered load of glucose exceeds the maximum tubular reabsorption capacity for glucose. Normal is negative and glycosuria, glucose in the urine. Leukocytes indicate infection or inflammation. Normal is negative pyuria, leukocytes in the urine. Cystitis, bladder infection, and pyelonephritis is kidney infection. Dipstick urine interpretation blood almost always indicates pathology because RBCs are too large to pass through glomerulus. Normally is negative. Hematuria is blood in the urine. Possible causes kidney stone, infection, tumor. Caution, very common finding in women because of menstruation. Urobilinogen produced in the intestine from bilirubin. Normally small amount and absence is renal disease or biliary obstruction. Increased in any condition that cause an increase in the production or retention of the bilirubin. Hepatitis, cirrhosis and biliary disease. Nitrate might indicate bacterial infection with gram-negative rods like E. coli. Normally is negative. pH 4.5 to 8. The urine pH should be recorded, although it is seldom of diagnostic value. Diet can alter pH. Acidic in case of high protein diet and ketoacidosis, and alkaline in case of vegetarian diet and UTI. Phosphates will precipitate in an alkaline urine, and uric acid will precipitate in acidic urine. Bilirubin indicates presence of liver disease or biliary obstruction. Normal is negative. Bilirubinuria, appearance of bilirubin in the urine, yellow foam when sample is shaken. Already discussed this part. Chemical analysis, sulfates. Normal constituents of urine. The urinary sulfate is mainly derived from sulfur containing amino acid and is therefore determined by protein intake. Phosphates, normal constituent of urine, important for buffering H plus in the collecting duct. Chloride, normal constituent, major extracellular anion. It is main purpose is to maintain electrical neutrality, mostly as counter ion to sodium, and it often accompanies the sodium losses and excess. Urea, end product of protein breakdown. Uric acid, metabolite of purine breakdown. Creatinine associated with muscle metabolism of creatinine phosphate. WBC in the urine, normal men less than 2 WBC in high power field, women less than 5. WBC generally indicate presence of inflammatory process somewhere along the course of urinary tract. Hematuria. RBCs may appear normally shaped, swollen by diluted urine or creatinine, or crenated by concentrated urine. And presence of dysmorphic odd-shaped RBC in urine suggests glomerular disease such as glomerulonephritis. Epithelial cells, too many squamous cells suggest contamination and poor specimen collection. And transitional epithelial cells originate from renal, pelvis, ureter, bladder or urethra. Large sheet of transitional epithelial cells seen in bladder cancer. Bacteria are common in urine specimens from contamination. Therefore, microbial organisms found in all but the most scrupulously collected urine should be interpreted in view of clinical symptoms. Struvite crystals formation is favored in alkaline urine. UTI with urease producing bacteria Proteus vulgaris can promote struvite crystals by raising the urine pH and increasing free ammonia. Uric acid crystals, high uric acid in the blood, byproduct of urine digestion or high protein diet associated with gout. Calcium oxalate crystals can occur in urine of any pH, causes dietary asparagus and ethyl alcohol intoxication. Cas hardened cell fragment formed in the distal convoluted tubules and collecting ducts, usually pathological, can only seen on microscope. Hyaline cas are composed primarily of mucoprotein secreted by the tubule cells, cause low flow rate, high salt concentration, and low pH, all of which favor denaturation and precipitation of TH protein. Red cell cas may stick together and form red blood cell cas, indicative of glomerulonephritis with leakage of RBC from the glomeruli or severe tubular damage. White cell cas indicates pyelonephritis. Other causes include interstitial nephritis. Physical properties: clear to pale yellow due to urochrome, and concentrated urine has deep yellow or amber color. Red or red brown abnormal could be formed from food diarrhea, eating fresh beets or drug, or presence of either hemoglobin or myoglobin. If the sample contained too many blood cells, it would be cloudy as well as red. Turbidity or cloudiness may be caused by excessive cellular or material or protein in the urine. Specific gravity measures from 0.001 to 1.035. 1.001 is dilute, 1.035 is concentrated, and is depend on solute concentration. If it is more than 1.035, is either contaminated or contains very high levels of glucose. Patients who have received radio opaque dyes or dextran can also have high specific gravity. Freshly urine is slightly aromatic. Standing urine develops an ammonia odor, and some drugs and vegetables, asparagus, alter the usual odor, and elevated ketone smells fruitier, acetone-like. Urine is 95% water and 5% solute. Nitrogenous waste like urea, uric acid, and creatinine it contains. Other normal solutes, sodium, potassium, phosphate, and sulfate, and calcium, magnesium, and bicarbonate ion. Abnormally high concentration of any urinary constituents may indicate pathology. Thank you.